This year's conference is moving from theory to practice, and particularly project delivery, project investment, and making the case for action on the ground.
I'm representing an organisation that is going to be building a very large-scale health and wellbeing project in the Northwest in Manchester. For me, really understanding the idea of social engagement and how our project is going to be able to leverage all the infrastructure and community networks to really make the most out of that project opportunity. So bringing together different community groups, bringing together local authorities, and understanding, as someone in the private sector, how to really engage well with those authorities to get the maximum best possible outcome for the people in the community and for us as project developer.
I think that's really interesting about how to engage with communities, making sure that health and healthy placemaking, the built environment, is taught within schools to really get people excited from a young age about the benefits of active travel, of healthy eating, food growing, and also the carbon implications of all these things as well, and how you can't really decouple human health from planetary health.
We really focus on this intersection between racial justice and climate change because from our experience, we're really concerned that the climate issue is being kind of addressed and explored without giving due attention to the fact that groups that have been racialized across a whole range of ethnic minorities are really feeling the hard edge of climate change in the UK, but also in their home countries. And so we really want to make sure that when we think about climate solutions and we're thinking about how to tackle the health issues that come with climate change, that we really think about the ways that different ethnic groups are experiencing that problem and making sure that all the resources and policy is well lined up to meet the needs of those that are worst affected.
There are lessons to learn in smaller economies, emerging economies, how they are grappling at that foundational level with engaging the people in communities and municipalities in creating this dynamic of health in local and national environments.
I work a lot in sub-Saharan Africa, and they don't have very good health services generally there. So what happens is the community are doing more. And sometimes that's quite simple things. And we've brought back several of those sort of things into the UK in different ways. So for example, you've got primary care much more run by nurses. You've got people called community health workers who are local people who are working in their local community. And in fact, we're starting to see that happening in the UK. Now that's on the healthcare side. On the sort of prevention and health creation side, we also have a lot of things happening that we can think about it. There's a great program in Southern Africa called Mothers to Mothers, which is actually mothers mentoring other mothers. You know, there's that kind of thing that we can think about. And very often that happens because in poorer countries, they don't have our resources, but they also don't have our baggage or history and our vested interests. And sometimes that makes them freer to think about things. It inspires you to think differently. It inspires you, if you like, to take off your NHS glasses, to see the world in a slightly different way.